Welcome, 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 everybody. We are so excited to have you here. I am Dr. Kelly-OMD, your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. And the way that we do that is through the Viva Life 5, where we meditate, journal, exercise, optimize our nutrition and our sleep while we eat the Viva Life 5 foods: fruits, vegetables, nuts, grains, beans, and we drink our water. All of that being said, if you do that more than 95% of the time, you will have a positive impact on your life and the lives of others. So that being said, I'm really excited to have our guest speaker here, Dr. Coleman, who is also a board certified physician. He is going to introduce himself briefly to you and tell us about the 3 things he wants you to take away tonight, and then we'll get started. Dr. Coleman, go ahead.
As you already said, I'm board certified in psychiatry. I've been treating people from the teen years all the way to elderly. I've spent a lot of time working on myself, which has really become my passion for translating that into mental health, because the brain and the body are connected. They're not separate. And unfortunately, what people don't realize is that if you don't take care of the whole body, you're not taking care of your mental health as well.
That is so true. And Viva Lifers, you already know this, but I know we have some guests here that are not Viva Life members yet, but I know you will become one soon, especially after hearing Dr. Coleman. So Dr. Coleman, go ahead, just break it off for us, break it down, because we need to know how we can take our meds per you.
Well, the first thing I always ask people is kind of to disrupt their thinking patterns. My quick statement is everybody wants to say they have a chemical imbalance. So I say, what proof? Did you get blood work? You know, if somebody's a diabetic, they'll go get blood tests and they'll have a hemoglobin A1C that will be elevated, and you will know. If somebody has high blood pressure, they'll have elevated blood pressure. You'll know. What proof do you have a chemical imbalance? Did somebody ever actually tap your spinal canal or draw the fluid from your brain? And everybody looks dumbfounded because that's the myth that's been put out there. And on one side is good because there was a stigma to mental health and people treated people like they were different. They should have just picked themselves up by their bootstraps. But the side part to that is it takes away the power from the individual as well. And so what you teach people is their only hope is a pill. And if you look at the studies that are out there, the STAR-D study, within 1 year, 50% of the people of the 67% actually got back to being depressed. And within a year and a half, 65 to 80%, that medicine no longer worked. You know how many patients I've had that come in and they've been on 20 different pills and they keep telling me this didn't work, that didn't work. And my simple statement is this: if I was a diabetic doctor and you came to see me and I gave you metformin, metformin works. But if you leave the clinic and I never ask you what are you doing, and every day you're stopping by Krispy Kreme getting a dozen lemon-filled glazed donuts, how well is the metformin going to work? Not too well. And I said, so my question to you is real simple when it comes to mental health. What donuts are you eating?
Mm.
And most people say, what do you mean by that? Well, if you look at the M.E.D., which is very validated study for depression, if you take antidepressants, it improves the M.E.D points by 1.3%, 3 points. You know what proper sleep will increase it by? 6. So just improving sleep is way more effective than taking a pill. Most people don't realize that exercise in Duke, they did a study at Duke in 1993. Exercise actually beat Paxil, Prozac, Zoloft in a head-to-head study for treatment of depression. Most people don't realize that. See, when we think about how we've evolved in this world, we live in buildings now. You're in a building which only gives out 500 light units. A cloudy day is 10,000 light units. A sunny day is 30 to 50,000. You know what your vitamin D level should be? Around 50. Most people, if you look at COVID, most of the people that had the highest mortality had low vitamin D levels. Vitamin D is a hormone that not only affects your bones, but it's a hormone that affects your mood and all other aspects of your body. And most people are deficient. Most people eat unhealthy. You talk about the Viva life. Most people eat unhealthy, so most of Americans are 40% deficient in magnesium. Magnesium is an important electrolyte to help with your mood and anxiety. So all of these things are the donuts that people kind of dismiss and not realize that you're constantly doing things that's offsetting any benefits any medication will do.
Well, you just broke it down for us because I mean, I hear vitamin D, magnesium. So these are like the basic building blocks of our bodies. And like you said, you get your labs done, they can tell you whether they're low or high. I know people sometimes will have a little difficulty getting that access to somebody that will actually do that. But, going back to those donuts. So I like the way you put that. So what are some of the other questions that you ask people in regards to those donuts? Like, how do you get down deep into what they're actually doing, and how do we change pattern?
So most people, if you unfortunately when you go to typical psychiatrists, they're just medication focused. They want to give you a pill, get you out the office. And that's why I said what I said about the donuts and the diabetic doctor. If you're not asking the important question what people are doing, then you're not doing them a proper service. People should Google Irving Kirsch, Kirsch. He did a big time study on treatments of antidepressants, and there's another guy, George Brown. He did a study, and what they found is this is where the whole concept of biopsychosocial model comes into effect. Is that all of the things that we ignore are important. So what I try to ask people when I do a life assessment when you walk through the door, I ask you about if you're single. I want to know what kind of job you have. Are you happy with your job? People don't realize that many people have jobs that are meaningless and that can cause depression. So I want to know about your job. Where are you living? A lot of people live in bad situations in their homes. People don't realize that. So I want to know where you're living, what you're eating. I always ask people, what do you eat the last 3 days? For the last 3 days, what have you been eating? For women, you shouldn't have no more than 9 teaspoons of sugar a day. And when you eat more than that, your body breaks it down. The cytokines break it down and produces a compound called quinolytic acid that crosses your blood-brain barrier, prevents tryptophan from being converted to serotonin. So now you're down regulating serotonin and increasing your risk for depression and anxiety. So I asked them about their meals. Write down specific what you've eaten the last 3. No judgment zone here. We want to build together. So what you're eating, what you're drinking, then I want to know your sleep patterns. How have you slept for the last 3 days? I try to break it down real simple, and I want to cover everything. If you have kids, especially with a woman's neurological system is attached to that child. That's what birthed civilization in the first place. The ability of a woman to think about somebody outside of herself. So women are the seed of civilization. So that woman has increased anxiety, especially as these kids are developing and growing, because that's a part of them intimately. So what is going on with your relationship with your kids? How is that going? So all of these things I ask them before they even walk through the door. And so what I do is I take all this information before you come to see me so that I can meet you, talk to you, and then I'll send you a full breakdown of all these parameters that I'm talking about, the donuts. So we're going to talk about the full life perspective of your whole life as far as what's going on with you.
So thank you so much, because I think we have a couple of Viva Life members here, and anytime I have a new member, I always do a full life assessment as well. And it's a little bit different because I'm not taking this from you as a physician. I am an OBGYN, so it's not just about knowing that part of your life, but it's also those social determinants of health, and that's really what you're addressing there. Is like, what are those social determinants of health that could be causing you to have depression, anxiety, frustration, significant anger, and not being able to interact the way that you need to and show up fully, not only in your personal life, but your professional life. So thank you so much for that. I think we have a question. I know someone who struggled with anxiety and depression, but managed to stop using psychiatric medications by altering their diet with the help of a functional medicine provider. What are your thoughts on how the gut microbiome influences mental health? Great question.
I push that. You know what 80 to 90% of your serotonin receptors are located in your gut. And guess where they came from? See, this is what people see. I'm trying to be brief, but
No,
what people don't realize when you're born, the most people back in the day came out vaginally. And so the way this thing was designed is when you come through your mother's birth canal, the bacteria that's there lines your gut. So you got your microbiota from your mother. And think of it from an evolutionary or however you want to look at a holistic perspective. If you're going to survive, you have to be able to eat and digest what she's eating. So here's what I always ask patients. Were you the first child? Were you second child? Were you third child? What was the situation that your mother was in with your father and mother when you were in the womb? Because things start happening in the womb as well as you come out of the womb. And if you were born C-section, which has been the big issue in America, then your gut bacteria is from the surgical room, which is horrible. So I always tell people, let's really dive into how you're eating. And I really push getting good, healthy gut bacteria inside of you. I push probiotics, eating onions, eating garlic. I eat kimchi myself. I just had kimchi on some beef, on some steak a little bit earlier. So I eat kimchi. I drink kefir. So I make sure to do the stuff to improve. And there's studies that show probiotics and stuff improvement as far as bipolar, as far as depression. So those things are important.
Absolutely. And you know what? I love what you said about the C-section, because you know in the United States, the C-section rate is upwards of greater than 20%, sometimes 30%. Definitely trying to improve that. And one of the things that, and we have another OBGYN on here, so correct me if I'm wrong, but you're right. I mean, there is something about coming through that birth canal. If you can, we want
Right,
safe mommies and safe babies.
right.
Um, there's definitely something about coming through that birth canal that you're taking in what the mother is giving you up until that last moment. And if you're breastfeeding, you really are taking in what mommy is giving you for however long you're able to breastfeed. But that being said, one of the things they're trying to do is like introduce the baby to the gut biome by utilizing other methods when they're having C-sections.
Yep.
And it's controversial. Everybody doesn't do it. But I know that is one of the things. So that was a great question, Talvo, and thank you so much, Dr. Coleman, for talking to us about that. Let's see, we have another question that's asked us how much magnesium, what is the required daily doses of magnesium?
So what I always do is I check lab. Everybody's individual. So I always get labs. So I shoot to try to get a magnesium level between 2.5 and 3. Especially if you have pre-existing anxiety issues. So I always check labs. When you come to see me the first day, before you see me, the day before you have to get lab work. So I check B12, I check magnesium, thyroid. We can go through the whole list if you want, but yes, that's a part of the protocol before you can see me. Is I get a full panel of labs on you before you walk through the door. So on your first visit, you're already filled out my packet, so I understand you. You already got the lab work. Because when you come to see me, I don't want my head down asking you 100 questions. I want to engage you as an individual so that I can get to know you.
Oh my God, I love that. I don't think any psychiatrist has ever told me to go get labs. I mean, we expect that from our primary care doctor, but never from our psychiatrist. And anybody, if they've had anything experiences different, let me know. But I've had 3 psychiatrists and 3 mental health providers, and I tell my team all the time, you need to have these people on speed dial. Especially in the high powered world that we are living in. And a lot of the people that are on this call and in the Viva Life Health Hub are really high powered people. So Dr. Coleman, thank you for doing that. I really appreciate that.
Let's say with the sleep, something as simple as sleep. People don't, like I said, the 6 percentage points, that's huge what people don't realize. And most people have poor sleep hygiene. So they're on their phones till they go to bed. And what people don't realize is your brain is like a machine itself. So it takes about 90 minutes for your brain to decompress from you being on these devices. So yes, you can get on the blue blockers and that does help, but you really need to cut off the devices 90 minutes before bedtime. So I always ask people, what is your routine 2 hours before bedtime? Because I talk to people, especially have sleep issues. You want to eat protein as your last meal, not so many carbs, because you want your blood sugar level. Because I'm really big on the hypoglycemic aspects of the glycemic index that you can pull up. So you want to be careful that your blood sugars are not going up and down, because that can cause problems with depression and anxiety. People don't realize that. For example, you really shouldn't eat more than 5 grapes at a sitting. People say,
Mm.
what? Yes, 5 grapes and a half a banana is all. So you have to be careful about something as simple as that. People say, well, I'm eating good. Not really. So that's why I asked you specifically, what are you eating? So we can sit down and talk about it. Are you getting enough selenium? So I go through all of these things, we don't eat enough fish in this country. And a lot of people are vegan. So I say, well, where are you getting the B12 from? You have to have B12. And your B12 level, especially with predisposed to being depressed, needs to be more around 500. So I go into specifics. So I took courses for functional medicine as well. So I have more of a functional medicine bend to my psychiatry. So I really get into the lab work and really break down some of those things for people. So
I love that. You are definitely breaking things down. We have another question. Is that okay for you?
of course.
Okay, very good. We have a question from Tiffany. Does poor sleep cause depression or does it make depression worse?
Both. Poor sleep can actually cause depression, anxiety, psychosis, and even mania. So you know you can actually induce psychosis by holding people from getting sleep, and if they stay awake too long, they can become manic. But poor sleep can actually, what you think about it this way: where everybody has a computer, and every so often you need to hit the restart button so that your computer can download, get all the updates. Well, that's what sleep does, especially when you get deep sleep. You really need deep restorative sleep because it actually resets things. So it helps decrease your body's levels of cortisol. And that's another thing women don't realize. There's a really good book, The Hormone Cure, and I'm a little ADD, but you should take the test and check certain things out. But your cortisol helps to get reset. All these things get reset when you get quality sleep. And if you don't, if you were stressed out at a level of 6 before you went to bed and you don't get good sleep, then when you wake up, you start back at 6. So you already started behind the 8 ball.
So my question there then, and I know we've talked about this a little bit in prior panels that we've been on. We talk about there's not a, you talked about the chemical imbalance, but what about the hormonal changes that both men and women are going through as they hit the 30s, 40s, definitely in their 50s?
Now that is huge. And that's why one of the things I do with all my female patients, I tell them about this book called The Hormone Cure. She's got a test that you can take that really goes through stuff such as concentration. It's really good. You should take the quiz. I tell all my clients, go take the quiz, come back with the results, and we're going to sit down and go through it. Because what people don't realize as you become older as a woman, certain things that we used to love to do, our body can't break them down the same as they used to. And
Mm.
so those things increase the levels of toxins that's in our body. And so you have increased issues of bloating, increased issues of concentration. You don't have your libido anymore. And people say, well, they just want to put you on an antidepressant to tell you, oh, that'll fix it. No, it won't. So, there are other things that we have to really dive into as far as somebody's hormonal balance. And I'll do the same thing with labs and stuff. And all of that is beforehand. And I do have some patients that basically when they see all the stuff they have to do before they come see me, they won't come. And I'm okay with that. I don't apologize. I'm not for everybody.
Understood. So question, because I've trademarked something called Manopause, MANOPAUSE. And that's because I noticed that men's hormone levels are decreasing as well. And those same
Yes.
signs of the hormone decrease, it seems that men are having, but nobody's really talking about it. They just want to
Nope.
give them a
That's
or
right.
so can you touch on that as well?
So one of the things that I really talk to men about, because your testosterone levels and your estrogen is in men have estrogens and stuff as well, and those things have to be in proper balance. And as men start getting older too, those things get out of balance. And as they get out of balance, what most men will do, they'll try to turn the things to take just testosterone and think that's going to fix everything. Well, if you just overload your body with testosterone, you're going to induce a whole lot of problems downstream. So what I try to get the men to do, let's do a full panel workup to see what else is going on in your life. A lot of times men don't eat so well. I don't know if you know that, but they eat fast food and junk food and they drink a lot of beer. And so I've had a number of clients whose magnesium level was like right at 1,
Mm,
right at 1, really low. Or
mhm.
vitamin D levels that are 16.2, or and their thyroids are thrown off. Their B12 level is like 112. So that can cause you, people don't realize vitamin B12 helps with energy and stuff like that. And so I've had a lot of these other aspects that have been problems, yet the men are only focused on the testosterone level. And so that's where I try to do a holistic approach, because it's not just testosterone, because all of these hormones interact. So you really have
Mhm.
to do a full medical workup for these men when they start having issues of, man, I'm not thinking as much. I'm having problems being more forgetful, or I find myself being more irritable. And so I ask all these kind of questions. That's why I say I do more of a life assessment. So my packet is pretty thick before you come through the door. So, and I usually, if you're going to see me, you probably, they would have to have, and I don't have any space right now. So I have a like a 6-month waiting period. So, but I try to get all that stuff ahead of time so that we can really sit down and go through it. Because everybody's a little different individually. And so if I get the labs in front of me, then we can have an honest conversation.
That is so good. I mean, we know that you're going to be backed up because people are already texting me on my phone. Like, does he take TRICARE? Does he see? How do I get in touch with him? But I think, even if we can't see you personally, I think number one, having you on here, that is amazing. So thank you so much for being here with us and sharing with us. But then also you have armed our guests with information that they need to go talk with their psychiatrist about, their primary care about, and really be self advocates about these types of things to make sure that they have all of the vitamins. And I think that's what's so important about it. Let's see, we have another question here. Let's see, from Sheila. Loving this. You definitely do not see this routinely in healthcare. Absolutely. Let's see, Tiffany. Thank you, Dr. Coleman, for the work that you are doing. It's always nice to hear a doctor treating the whole person and offering non-medicinal treatments. The sick care model, medicines, procedures, and treatments seem to rule the country because they are costly. And let's see, Barbara Thomas says, thank you, Dr. Coleman, for sharing your diverse knowledge. That being said, we have about 4 or 5 more minutes left. Is there anything else that you would like to share with us tonight, Dr. Coleman?
Well, let me talk about the take the meds aspect. So when I do my assessment, the mindset is I try to find books that help people to understand themselves. And so that's why I want to get to understand you. So a lot of women that when the hormone cure is one of my key books, complex PTSD. So based on their issues, I give them books. I send videos. I find videos on YouTube. There's tons of short videos that are very impactful. So the impact of childhood abuse. People don't realize that's where the ACEs comes in. You should Google impact of childhood trauma on YouTube with Gabar Mate. It's very powerful. I always tell people to look at the video Prison of the Mind. So that's my mindset. We got to work on that. And then for the meditation, people don't realize how powerful meditation is. It actually, if you do a functional MRI, it lights up the periaqueductal gray area, and people actually improve in regards to anxiety and depression. It's something as simple as a deep breath. So I talk to them about the importance of exercise. We start off with the 2-minute rule. I tell them 2 minutes on everything for a whole month. See, the problem is most people try to do too big and they get overwhelmed. And they say, that ain't gonna do nothing. Yes, it will, because we're not running a sprint, we're changing our life. So just for 2 minutes of workout, lunges, plank, squats. That's all you do for a whole month, 2 minutes. And so we build up, build up, build up. And then if we can do that for a month, let's add 2 more minutes. And we do slow progression because we want to build momentum. Same thing with diet. I want you to write down everything horrible you eat, drink, or whatever. And we're going to take one thing at a time and remove it and replace it and remove it. So it's not overwhelming. Same thing with sleep. We're going to go through the sleep hygiene. We're going to look at what you're doing. We're going to slowly go through one thing at a time. That's what people don't realize. Meditation, here's my rule. There's a really good book, Atomic Habits. Pair what you want to change with what you already do. So for me, I drink coffee. Love coffee in the morning. I keep a 32-ounce Noops cup by my coffee thing that says, before I get my coffee, I have to drink this water. So I start my day with a little pink Himalayan salt in my water. So I get my magnesium so that I can replenish myself, because you're most dehydrated first thing in the morning. People don't realize that. So if you start your day drinking coffee and you didn't hydrate yourself, you're already setting yourself up for anxiety. So that's Atomic Habits. Find the things and make them small. Small incremental steps over time actually changes your life.
Love that. So the 2-minute rule, y'all heard it. Y'all heard it. So don't tell me you can't. We know that you can. And that pink Himalayan salt. So you utilize the salt instead of maybe taking a magnesium pill, or just tell me a little bit about
Well,
that.
I do the Himalayan salt. I actually do a hot bath with some Epsom salt sometimes. That's magnesium as well. And it helps you to relax. I drink a little chamomile tea with some natural honey, local grown honey. Don't get the honey out the store that's not local, because it's not the same benefits. But yes, I try to get my magnesium in my body, either absorption that way. If you can't get in the tub, get you a hot pan like they do in the old folks and soak your feet in some Epsom salt. Your body will absorb it, and it'll actually soften your feet as well. So it's a nice way to relax. So I try to really push people to get that magnesium in their body.
I love that because number one, my mom, Epsom salt baths, absolutely. And I remember my grandmother, something happened with my cousin, and she wrapped his foot in a brown paper bag with a towel that had Epsom salt soaked into it, wrapped that all up. And
Yep.
his feet actually got better. He was having pain in his feet and
Yep.
probably some muscle contractions and
Yes.
stuff. And
Yes.
to myself, who is wrapping somebody in a paper bag? See, the things that our ancestors,
the things our ancestors knew, they knew.
the things that our ancestors knew. All right, looks like we have a couple of more. Let me see something. What advice do you give to healthcare providers who see patients that could benefit but do not have Dr. Coleman in their area, and providers are limited in time constraints for appointments?
Ooh, that's a good one. Well, I'll be honest with you. There's not a lot of psychiatrists that think the way I do, that I've run across. So I can't, I don't have a good answer on that one. What I will tell you is there are tons of books. Chris Palmer has a book called Brain Energy. So Alex Korb has a book called The Upward Spiral. So I read all these books. So, and you can go on YouTube and find people like Dr. Daniel Amen. So you might have to go outside with the technology we have and read books and get that. So I sent you an email with a list of all my books, because as I get patients, I collect and I try to read everything. And so I compile a list of different books to help people to work on themselves. And so in that way, they can get the information.
I love that. Thank you so much. I think my virtual assistant and I, for some reason, didn't get the email. So I'm going to text you my email address so we can get that email, because I want to be able to share that with our Viva Lifers and our special guests that continue to come on a regular basis, so that they can have those books as well. But then also, Dr. Sheila, one of the things I highly, highly recommend is that we continue to all work together and share this information and knowledge. And as we do that, you'll have more tools in your toolbox in order to be able to help your patients as well. And I know Dr. probably teaching people how to, I mean, even tonight, you're teaching people. So you are a force multiplier for this information, and you've already spread the word. So just that, this 25 minutes that we've had together has made a significant difference. And looks like we have about 2 minutes left. So Dr. Coleman, you want to round us out?
Well, I was going to tell people I created a Facebook page called the Healing Center of Grace. I know that's kind of cheesy, but what I do is I took every one of the mental problems, like people pleasing, something as simple as that, depression, anxiety. I created a post, and within the comment section, all the stuff I've read, the books, the videos, if it's beneficial, I put it in the comment section. You can look in it and you can find all kind of books and information right there. And I've have a couple of podcasts where I've done stuff on trauma myself, talked about it. So I put that on there as well. So people can actually go there as a nice way to get some resources that I'm talking about. I forgot about that. So
love it. I love it. Well, you know what, Dr. Coleman, I'm definitely going to take your advice and use these resources and share them with our Viva Life members as well as our guests, because I'm always looking for opportunities to increase knowledge as well as expand my understanding. So thank you so much for being on here. I knew you were going to be amazing. This is the third time that I've seen you speak, and every single time you just always enlightened each and every person that is listening to you. So thank you so much for doing the work that you do in the way that you do it and for the reason that you do it. We really appreciate it. And Viva Lifers, I'm Dr. Kelly-OMD, your board certified OBGYN and healthcare executive, bringing you the best of the best so that you can live your healthiest and wealthiest life. So have a wonderful evening, everybody. And don't forget to do it. Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly-OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.